This is Heart Rhythm TV, and I am Julie Shea here with another episode of Advancing Allies. I'm excited to introduce a new series today entitled AP Happenings. The goal of this series is to highlight the accomplishments of the Heart Rhythm Allied Professionals, not only on the local and national level, but globally as well. For this inaugural episode, I have some of the team members from Project PACER who just recently returned from a trip to Bolivia. So I have the pleasure of introducing to you Dr. David Martin, who is a clinical electrophysiologist and vice chairman of medicine at Brigham and Women's Hospital, and he is actually the president of Project PACER. I also have with us Lauren Rousseau, who is an alumni of HRS TV. We've seen her. She's joined us here for other topics, but she was actually one of the team members to Bolivia, and she is a senior physician assistant at Brigham and Women's Hospital in cardiac electrophysiology. And I have Mary Lee Mate, who is a lead nurse practitioner at the Leahy Burlington. So welcome, everyone. Thank you so much for joining AP Happenings tonight, and we're excited to hear about your trip and your experience down there. So David, I would like to start with you. Can you tell us a little bit about Project PACER? Kind of when did this start? How did it start? What is the mission, and how has it progressed over the years?
Thanks, Julie, and it's really a pleasure to be here. Project PACER International was started in the early 1980s by two cardiologists and a cardiac surgeon in Boston who realized that they had skills that other people around the world needed. And this was, a long time ago. It was focused on providing pacemaker therapies to indigent patients around the world. The work that we do in Bolivia first got started in the late 1980s and early 1990s. The first time I went to Bolivia was in 1992. And it started with a cardiologist called Bob Carey, who had been to high school with a chap who became a missionary priest and spent his whole career in Bolivia. And this chap called Bob Carey one day and said, Bob, we've got a lot of people down here with some funny heart disease that nobody understands, and we need some cardiology help. So Bob went down, and after a few minutes of being there, he realized that a lot of these people had bradycardias and were, in heart block and needed pacemakers. And when he came back to Boston, he asked me if we could get involved. And I had the honor of going down there in 1992. It wasn't the first time that we had been there, but it was the first time that I went there. And it really was a striking situation where there is endemic Chagas disease in this country, and in certain parts of the country, 50% of the population or more is tests positive for the parasite that causes this disease. And so there's a lot of relatively young people with complete heart block and bradycardias who need devices. And so we found that this was an ideal match, if you like, for our skill set. And we were able to provide these very poor people pacemaker therapies over the last 30 plus years. And many of these patients have come back and have had multiple devices, and we've looked after hundreds of patients over the years. It's been a great privilege for us to do this. We go every year and we bring with us colleagues from Boston and from around the world. Our organization is an international organization. It's a registered charity, but it is international in its orientation. And we have colleagues from all over the world, from the UK, from Europe, from South America, and obviously from the US and Canada, who have participated over the years. And the complexion of each group is a little bit different every year, but we usually travel with about 15 to 20 colleagues. Physicians, advanced practitioners, medical residents, medical students sometimes. And a large focus of our work is to provide indigent care, but also to provide education. And we learn a lot from our colleagues in Bolivia in terms of how to do good quality medicine in a resource-poor environment. But we teach them implant and follow-up skills with pacemakers and defibrillators, and they teach us a lot as well. It's been a truly remarkable experience over the last 50 years, and I'm glad to say that our organization was recognized actually by HRS in 2021 with the Global Humanitarian Award of the organization, which we're very proud of, and we continue this work. I look forward to hearing Lauren and Mary Lee describe their experiences on our recent trip. In early June of this year, we were in Santa Cruz, Bolivia, for working there for a week.
Yeah, I mean, I've seen some of the pictures from it, and it looked absolutely like an amazing experience. And just the outreach and the care that you're able to provide to these patients is truly amazing. Lauren, can you talk a little bit about the team that went with you to Bolivia this year? Who was there? Who joined you there this year?
Yes, absolutely. Thank you, Julie, and thank you, Heart Rhythm, for having us here today to discuss this really important mission. So our team at Project Pacer for this initiative included a multidisciplinary team of professionals, as Dr. Martin has described. So it included 6 physicians, 2 allied professionals, Mary Lee and myself. We had 2 cardiology fellows, 2 research fellows, 1 device technician, and 2 device manufacturer support people. And it was really remarkable because a lot of us didn't meet each other in person until the morning of departure in the airport, or even some of the physicians who were coming from another country we met in Bolivia. So once the team met and everyone had arrived, it was really evident the energy and everyone's underlying goal and mission to help serve and take care of these patients. And the team quickly got to know each other and worked together extraordinarily well. And it was awesome to see such a great diverse group of people who didn't know each other at the beginning of the week really work together and come together as a cohesive team and care for these patients. Something that was really important was how everyone played an essential role in the success of the everyday care of these patients and the overall mission. We utilized everyone's experience and expertise in order to try to minimize resources while providing this critical life-saving care. For example, we had an echocardiographer who would perform an echo and let us know how many leads the patient had in the heart and efforts to not get an x-ray. Or we had the echocardiographer then tell us what was the ejection fraction and what was the most appropriate device for this patient, a pacemaker or defibrillator. And then we also worked closely with our device vendors who kept a close count of our device and supply inventory so that we can make sure that we use that to the fullest extent and care for our patients, provide as many patients as we could the devices that they needed. Another reason why our team was so successful and efficient was our daily meeting that was led by Dr. Martin. And during this time, we would review all the new consults from that day, those patients that we saw, and we were able to triage patients based on the urgency for the device implant. We also worked with team members from the local hospital and other local physicians in efforts to review the resources and supplies that we had to care for these patients the following day. And lastly, Mary Lee and I really worked well as a team, and I was very thankful to have her because she has been on this project, she's been in this mission and been to Bolivia before, and so she was a great resource for me in learning how to care and manage these patients. And it's also worth noting, just discussing the preparation that went into this project, including organizing supplies, making sure that we had the appropriate equipment or the device programmers, and even writing letters to the consulate to make sure that when the supplies arrived in Bolivia, that they were appropriately received.
Great. Well, Mary Lee, can you talk a little bit? You've been involved with Project Pacer, it sounds like, for quite some time. Can you talk a little bit about your experience with that and this trip in particular?
So I've been involved with this project since 2014, when first introduced to it by Dr. Martin, and it's been a wonderful experience. We were on a hiatus for a little while during COVID, but this year we returned, and it was fabulous to return again. What was interesting this year, as Lauren had mentioned, is we had a lot of brand new team members, but everyone worked so cohesively together, and it was just a great experience. We were in a different hospital this year, but the patients came from far and wide to seek out our care. There was some publication about that prior to our arrival. When we got there, some people had been on buses for hours, coming from some very poor resourced areas of the country to seek care. I would say that while we were there, we saw over 200 patients in clinic for device checks and also in-person consultations for device evaluations. About 50 people received echoes, and we implanted 35 devices. And as Lauren mentioned as well, that we had to look at the criteria and the best candidates for devices that were available to us. I think that what is also very heartwarming is that we work in this culture that's different from our culture. The language is different from our language, but we still have the ability to treat these people with the care that we take care of a patient in the Boston hospital because of the care we bring and the resources we bring there. I think that we treat them with the same heart and soul. And in some ways, it's just maybe a little more touching because they are so in need of our resources and they are so grateful. Their gratitude is immense. So I would say that as far as what I found most intriguing beyond the patients is us trying to deliberate who's going to get the devices for the next morning. That's a very intense process that there's a lot of collaboration on. And we try to give the devices to the most appropriate patients, which is extremely difficult for decision making at some points. But
yeah, I imagine that is extremely challenging. I heard some stories from Lauren and some other folks that were down on the trip talking about, well, this person's got one wire lead and this person really needs a dual chamber device. And so kind of trying to mix and match, with patient, what their true needs are, based upon, what hardware they may have already established, what their clinical indications are, and trying to give a very thoughtful approach to who gets what, because, you do have a limited number of devices and more patients that need them than you have supplies for. So, David, Lauren, do you want to talk a little bit too about kind of what that selection process is like?
I'd be happy to, I think the first thing to say is that we're very grateful to all of the device companies for their donations. And over the years, we've been supported by all of the major device manufacturers. I have to say it's never enough. The reason we're having this discussion about the difficulties of device selection for patients is because we don't have an unending supply of devices when we're there. And so we do have to be very, very careful and maximize the potential benefit for each patient that we can. And we came away this time, having implanted 35 devices, we came away with a waiting list, as it were, of patients who need devices. That's about 12 or 15 patients who we have their contact information, and these patients will get devices when we return in a few months. So, the need is there, no question, and the need always exceeds the supply of devices that we have, despite the fact that the companies have been very generous with providing devices to us. Lauren, perhaps you could sort of talk a little bit through the afternoon meeting that we had every day and how the discussion evolved.
Yeah, of course. So I think David, correct me if I'm wrong, but I think this was something new that you had initiated with the team. And I think it really was essential in reviewing these patients and trying to triage and determine what was the most appropriate next step for these patients. And again, I think that's why it was also essential to have our vendors there and aware of the inventory and knowing how can we be creative in these patients. For example, some patients who maybe didn't need a defibrillator generator, but needed the pacing capabilities, we would use the defibrillator to be able to provide the pacing capabilities for those patients. And so being able to do that and coordinate with what we had was really essential in utilizing our materials to the highest extent.
I think these meetings, we've always had a huddle at the end of the day to put together the list of cases for the next day. What we did differently this year was that we made the huddle more of a formal meeting where everybody was expected to come. And I think it worked well because we had such a large group. And, one of the things that I think the audience should understand is that our group of 15 was really divided into sort of 3 groups, where we had a group of people working in the operating room just doing implants for that day, a separate group seeing outpatient consultations, and a third group doing device checks and evaluating patients with devices. And so bringing those 3 groups together at the end of the day to share experiences about what happened in the operating room, but also to present the new patients and to discuss the potential list for the next day, I think is very helpful to keep everybody sort of fully oriented to what's happening, keep everybody on the same page. It worked very well. And we had not done that before, although we did have a sort of an informal huddle in previous years. We had to in order to bring the cases together. But I think this did work well. I agree. And I think it has an important educational benefit. It's also very good for transparency because we had representatives from the hospital administration at this meeting. Everybody could see what we were doing was focused entirely on the benefit of the patient, that everything was open. There was no issues about somebody jumping the queue. There was no question about some sort of corrupt use of a device, which is always a potential thing that people have raised in the past. And we have to be very clear that our work is completely open and transparent in that regard, with a focus entirely on the patient. So I think that was a good introduction. I agree, and I think it's something that we will certainly continue in future years.
Yeah, I mean, it's one of the things I did, as I mentioned, looked at all the pictures that were taken down in Bolivia. And one of the, I think, most impactful things that I saw was a gentleman sitting on a bus with a huge grin on his face, just elated that, he got his new pacemaker put in. And, Lauren, I'll throw this back to you and Mary Lee, kind of from the Allied Professional standpoint. I mean, that joy and elation, it must have been an amazing experience. What did you find most impactful from your trip?
Yeah, it truly was. And I've done previous international work, but never in an EP focus. And so this was especially suitable and insightful mission for me. And it was also a tremendous opportunity for me to learn more about Chagas disease and its cardiac effects on patients. My role during this trip really included seeing patients in sort of those 3 different blocks that Dr. Martin had described. So I was able to see patients in our device clinic who were coming in for routine checks, those patients who were coming for their post-op day 1 device check after they had the device implant the previous day. I also spent time seeing new patients and reviewing their medical history and determining whether or not they were appropriate for a device implant. And then also I was able to scrub as first assist and helping implant these devices as well. One thing that I found very educational was also understanding how to device troubleshoot or program devices specific to these patients. So some of these patients had not been seen in years or even maybe, since implant. And so knowing how to fully assess these devices, in some cases, we weren't able to interrogate them. So maybe placing a magnet over the device and determining how we can best care for them, or how we would program them to optimize their battery longevity. And ultimately, as said Julie and Dr. Martin, it was truly a very humbling experience to see how sick these patients were. Some of them were walking around with a heart rate of 30 beats per minute for months at a time, and yet they continue to work and care and provide for their families. And often these patients, we would see them again on post-op day 1, and they would feel remarkably improved, and they were very grateful, like Mary Lee had said, for our care, which was really amazing. And so it really was an incredible experience for me as an allied professional, and I hope to continue this relationship with Dr. Martin and Project PACER in the future, and also hope to continue to get more allied professionals involved.
Mary Lee, do you have any last comments?
So my last comment is that from a professional perspective, I agree wholeheartedly with everything that Lauren said. From a personal perspective, having this be a return trip, to see some of the same patients come back with their same families, bearing gifts specifically for Dr. Martin is incredible. They're just the gratitude and their appreciation. And yes, Lauren's correct. We have to program these devices to get them to the next time we come. But I just think there's such heartwarming gratitude from these patients and their appreciation. So that's my big takeaway.
Yeah, well, it's amazing work that all of you and your team from Project PACER accomplish on an annual basis. Certainly to be commended for this global outreach to help this unique patient population, for sure. So thank you for joining us today to talk a little bit about your experience. If listeners are interested in learning more about Project PACER, you can go to their website, which is projectpacer.org. This is Julie Shea for Heart Rhythm TV.